Hello, this is Dr. Kavian Melani for this episode of Virginia Medical Updates. One of the major issues that I have to deal with in my medical practice on a day-to-day basis is to give patients recommendations for physical activity and for exercise. Some of the patients really do well. They're athletic, they run marathons, they participate in races, they're in good form, they bike. A number of people are really excellent athletes, and that's probably about 10 to 15% of our patients in Fairfax in the Northern Virginia area. They have lean muscle mass, they have a very good low body fat, they have cardiovascular fitness, they have a fit BMI, low body fat. But a lot of other patients that come to the office really are stressed out. They are physicians, they are lawyers, they're dentists, they are construction workers, they're carpet installers from different fields. And they do not have the know-how, the time, or the interest for exercise, in a sense that it is not part of their day-to-day planning. It is not part of their day-to-day management of their activities, and it's an issue that they know that they should do something about, but they're not really actively engaged in trying to figure out what to do with that. So for these patients, the best thing to do is to figure out, what are you interested in? And what are your goals in exercise? Do you want to go back to your high school kind of shape, high school body? Do you want to eradicate diabetes? Do you want to manage your cholesterol? Do you want to get rid of your abdominal girth? Do you want to basically look more lean? Or do you want to have basically more cardiovascular fitness? So the first issue is to figure out, what do the patients want? Then the second issue, which is very important, is to figure out, what actually is it that the patient is interested in doing? Someone, for example, may be really interested in hot yoga, but someone may really deplore hot yoga. So I can't prescribe yoga in heat for everyone, but some people may really enjoy running outside. Some people may really enjoy running on a treadmill. Some people may really enjoy playing a game of basketball twice a week. So basically, whatever people choose to do, or whatever I prescribe for people, first of all, it needs to be something that is actually fun and enjoyable. There's no point in giving people an exercise plan that involves an activity that they do not enjoy. The other limitation is cost. Some people can have gym membership, pay for it, month after month, $120 a month for years on end, and never go to the gym. Well, I disapprove of that, because I don't want people to waste their money either. If people have a gym membership, I want them to be able to go to the gym and enjoy it. However, if people don't want to go to the gym, that's perfectly fine. For the basic level of fitness, I think 3 or 4 times a week of half an hour of fast walking is a great place to begin. It's not very intense on the time. It is doable in the Fairfax, Northern Virginia area most of the times around the year, and it is cheap. It is not cost prohibitive. You just have to buy a pair of sneakers, running shoes, walking shoes, and then you could do that. So that's the first thing. The second thing is, what is it that actually people want to achieve? If people want to basically go to the form that they had in high school 20 years ago, then basically the level of activity has to be increased. It is may require more organized activity, maybe a coach for some time, maybe a personal trainer for some time, to get to that level of fitness and exercise. But in general, for most of my patients, I see, what are they interested in doing? If they like to play basketball twice a week, that's fantastic. If you like to play soccer, indoors, outdoors, that's amazing. Running is a cheap, affordable, fun exercise. Biking has a lot of followers or good trails in Northern Virginia that people can use. And people can also, at the least, do fast-paced walking, which is really beneficial and has all kinds of cardiac benefits and is very useful. So having said all this, I definitely want to encourage everyone to figure out physical activity for themselves. It turns out that it has benefits on cholesterol management, body obesity, decreasing abdominal girth, which can lead to diabetes, hypertension, and a lot of other bad things. And it actually does improve mental functioning, decrease anxiety, and has an antidepressant effect. So all these benefits, some level of activity is essential for everyone, but it has to be tailor-made for everyone. And again, it has to be something that people like to do, is enjoyable, not too expensive, and does not basically impose on the rest of what in generally is a very busy lifestyle. So my final recommendation is anything you want to do is great as long as it's organized and you do it on a regular basis. And definitely I do not recommend spending a lot of money for this, whereas most of the fitness can be achieved with a few dumbbells in the house at a cheap price, or walking or running or biking. Again, this is Dr. Kavian Milani for Virginia Medical Updates, and I look forward to seeing you at our next episode. Thank you.